Good morning. If you don't know who I am, I'm Candace Nussbaum. I'm the Director of Education here at Circadia. And today joining me is Savannah Grisafi. She is one of our absolutely incredible international global educators here at Circadia. And she's just an absolute joy. She's so much fun to learn from. So she's the perfect person to be leading the education on this topic today. This is something that Savannah is very passionate about as an esthetician, has a whole ton of experience in. This is as the rosacea and just sensitive skin in general is something that she also treats a lot in her own personal treatment room. So without further ado, I'm going to pass over to Savannah and let her take it from here for just a little bit. Thank you, Savannah.
Thank you, Candace. Like she said, I am so excited to be doing this with you guys. When she came to me and said, "Hey, would you maybe want to do the Rosacea and Sensitivities webinar?" I was like, say no more. I am so in. Tell me when and where. I will be there. I am so excited to talk about this with you guys. And like Candace said, it is something that I treat very often in my treatment room, but it's also something that I suffer with personally as well. A lot of times you'll hear estheticians say, "Yeah, I got into aesthetics because I suffered from acne and I wanted to learn how to clear my own skin and help other people clear their skin." And that's how sensitivity and rosacea was for me. Something that I never had the opportunity to do was super fun skincare because my skin would just get super inflamed and very angry with me anytime I did anything, especially in aesthetic school. We all know how aesthetic school can be, right? We're doing treatments on each other on a almost weekly basis sometimes, and it can create flares, whether in sensitivity or acne. And I just fell in love with the science behind how to treat sensitive skin, and here I am. So here we are going to go ahead and get started with first and foremost, figuring out how to differentiate rosacea and sensitivities. Of course, here in the States, we cannot diagnose. That's going to be a different factor depending on where you're located, country, region, state. But the umbrella that we all fall under in the States is that we can't diagnose. However, we can know and learn the differences between things like a diagnosis of rosacea and just sensitive skin. Now, we can also treat the side effects of these diseases, right? And sometimes the side effects of the medications that we are sometimes prescribed from dermatologists and other doctors as well. So we'll be going over that a little bit later. But first and foremost, identifying the differences and those similarities, right? So your differences with rosacea, that's going to be something that they have definitely dealt with the majority of their life. They've always had redness in the skin. They've always flushed very easily. They've always dealt with some kind of rough texture in the skin. They've always had some kind of external, or if they've figured out the patterns for internal triggers as well. Those internal triggers can be something as simple as ingesting red wine, alcohol of any kind, and even gluten. That's something that has become apparent in studies, is that there are a higher level of rosacea patients that also have any kind of gastrointestinal disease as well. And sometimes gluten sensitivity falls in that line. However, if we know that within consultation or even just skin analysis, we can't say here in the States, "Hey, you probably have rosacea." We can have that light bulb go off in our on our mind and say, "Okay, maybe we should ask them if they've been to the dermatologist, if they have a diagnosis of rosacea. And if not, kind of push them along and give them that encouragement to go to the dermatologist and get a diagnosis if necessary." Those other triggers are going to be things like going outside when it's really hot and spending a lot of time in a higher elevated temperature, whether that's even something like hot yoga, things of that nature. Doesn't have to be necessarily outside. But they're also going to have that papular and pustular acne. However, it's not going to present exactly like traditional acne is. That's something that can be a little tricky and sneaky in the treatment room for sure. Sometimes when clients come in, they're going to put on their consultation form, acne is a concern of mine. However, you have to differentiate during that skin analysis and those consultation questions if it's actually acne or if it's being caused from overexfoliation and the skin is sensitized, or are they actually suffering from a subtype of rosacea? those are things that are going to be going through your mind and not necessarily something that you're going to say is a diagnosis, but you know what's going on behind the scenes, right? So those questions that we ask, that detective hat that we put on and ask those questions of, have you dealt with this for, for as long as you can remember? Is this something that's new? Is itchiness new? Things of that nature. Your similarities are always going to be redness. Like for me, I'm sensitive, but it has progressed for me over time. I've always had redness in my cheeks. However, Circadia has fixed a lot of that for me, and that was the main thing that made me fall in love with the line was I was able to treat my redness and not have a lot of sensitivity with my enzyme treatments or even the gel peels. The lactic gel peel is something that I never thought I'd be able to touch with a 10-foot pole, and I can do that on a monthly basis if I want to. Your other similarities are going to be dryness. A lot of times, both types of clients that either have rosacea or sensitive skin are going to have dry skin. Now, some of your subtypes, especially the ones that present with that papular and pustular type of acne, they're likely going to have an overabundance of oil production. Now, the other thing that can happen is if the client is treating it as traditional acne at home with like salicylic acid or even mandelic acid or something just a little bit more aggressive, a mechanical exfoliation, even that can impair the barrier for a client, excuse me, that has a subtype of rosacea. And then that's going to create an overabundance of oil production. So then we have to go back and repair that barrier before addressing any other concern, right? We always want to treat inflammation first. Now, speaking of what we're going to treat and what we're not going to treat, is going to vary. Again, depending on what your scope of practice is. However, in the States, we want to make sure that we're not treating things that look like broken skin, those watery blisters that just look super uncomfortable on the skin, things like that. We want to make sure that we're letting them know, like, I would love to treat you today. However, that your barrier is looking to be a little too imbalanced for us to do a true treatment on you. Here are some home care things that I would love to send you home with to get started with for about 2 weeks or so. And then they can come back in. Now, those watery blisters and things like that, that's going to be something that I personally would refer out to a physician or a dermatologist to correct and treat because they probably need a prescription strength of a topical or an oral medication, whatever the case may be that the doctor feels is best suited for that client and that patient at that time. And then they can come back in. And you could even do something as simple as just a gentle double cleanse with vitamin veil cleanser, lipid replacing cleansing gel, and put them under your LED light. The LED light therapy is very helpful for rosacea and for red light in particular. Red light is as well. However, I prefer infrared because it doesn't create as much heat in the skin as red light can. And that's going to really help bring that inflammation down. And even swelling, it can be really helpful for as well. Now, your skin analysis, during your skin analysis, that's super important. When you're touching a client, I always say, coming out of school, we have as much information and as many tools as they can provide us. However, when we're getting our hands on more clients, that's going to give you a leg up as far as how well versed your skin analysis can be. I've seen many different patients throughout my 7 years of being in aesthetics where rosacea clients can have a smoother texture. However, a lot of times, depending on what their triggers are, that texture can be a lot more rough. It can be actual visibly flaking dry skin, and it can just be sensitivity, and that can be pilot error sometimes. That over exfoliation can create a sensitized skin and an impaired barrier, and we want to make sure that we're correcting that before moving into anything else. So the other thing that I wanted to touch on, of course, is that Demodex mite. We all know, we learned in school that we all have that. And when I learned about that, I was like, okay, I'm going to go home and probably scrub my entire body until I have no skin left because why do we have to have that? However, they are an important part of our microbiome on our skin. But with rosacea clients, this Demodex mite is going to be at an overpopulated rate. So that can create an imbalance in that microbiome and create a lot of these side effects that we're seeing in the skin, that redness, the inflammation, things like that, which we'll touch on a little bit later as well, of what they really deep dive and create into. But the pre and postbiotic mask is something that's going to help repair that barrier and help that microbiome be in a more stable state. It's not going to necessarily target the Demodex mites. However, if you're using things like the Rosie's Relief Cream at home for home care and using the pre and postbiotic mask in the treatment room, it's going to help hit on both angles of that. So, what is this? We hear about rosacea all the time, all over TikTok, all over the internet, in the treatment room. Clients are coming in and saying, I think that I might have rosacea, but do they really? We're not sure. It might be a buzzword. We have to really, again, put that detective hat on and ask those in-depth consultative questions to make sure that they're not self-diagnosing and coming in and actually just having some sensitivity, or they're using something that might be a little bit too aggressive for them at home. If they're using salicylic acid every day at home, no matter what the efficacy rate of the ingredient is or where they're getting the product from, it's absolutely going to create an impaired barrier, right? We shouldn't be exfoliating every single day at that level. The salicylic acid is a very small molecule and it really can be aggressive, right? So those are just simple things that we have to think about as the client's coming in and we're reading their consultation form and we're doing their skin analysis. When we're touching the skin, that changes everything, right? So, obviously, rosacea is an inflammatory disease. This is something that can be treated and it can be maintained, just like acne. It can be maintained, but it can't be cured, right? This is something that we have to figure out what our patterns are, what our triggers are, and kind of keep that at bay, right? We want to make sure, sometimes we're going to divulge and we're going to have a little bit of gluten or we're going to drink a little bit of red wine and we might have a little bit of flushing the next day. We might have a little bit of a flare up. That's something that I have come to the conclusion of for myself, and it's in moderation is what I like to say. There are no single histology features that say yes or no. It's very unique as to who and what and why for rosacea. However, biopsies can be done to make sure that other things are being ruled out and it is for sure whatever subtype of rosacea that the doctor is thinking that the client may have. Broken capillaries and telangiectasia are going to be something that you will see very often in rosacea clients, not necessarily your sensitive clients. That can be a visual telltale for you during your skin analysis as to, okay, maybe they do have rosacea, even if it's just subtype 1 and it's very minimal and it's just diffused redness and those broken capillaries. Now, your sensitive clients are going to have that diffused redness and warmth to the skin, but they might not have that telangiectasia. They might not have the sebaceous hyperplasia. Those, if you're not familiar with sebaceous hyperplasia, it's going to be a very minimal raised bump on the skin. It's going to be flesh colored as well. Sometimes people like to say that it looks like a little donut. It doesn't always have a little hole in the middle, but sometimes it does. Of course, we want to make sure that we're not treating that and saying, hey, you have sebaceous hyperplasia. If a client asks, what are these bumps on my head, on my forehead? Usually they're on the forehead area. Sometimes they're through the cheeks and the upper cheekbone and temple area as well. Um, you can say in what I have found that works for me in the US is in my experience for clients that have come to me with an official diagnosis is that it is sebaceous hyperplasia. Same thing goes for rosacea. If a client comes in and says, I don't know what's going on with my skin, these are my triggers, this and this and this happens when I do XYZ, when I drink XYZ. You can say, in my experience, when clients have come in with a diagnosis of this, their skin has also been presenting with what you are presenting with. I would recommend that you go to the dermatologist for an official diagnosis. If you don't want to, we can treat the concerns that you have the way that I know how to treat them, which is we're going to be treating inflammation. We're going to be treating dry skin or oily skin. just keep in mind that the client is going to have a higher level of sensitivity. And because you will have some clients that don't want to go to the doctor, they don't have insurance or whatever the case may be, they don't want to pay for the copay if they do, or they might need a referral from their primary physician. Many different reasons. So, those are areas where you're going to have to pivot while also still not diagnosing, but continuing to treat the concerns that the client is coming to you for, right? Okay, so now we're going to talk about the differences within the epidermis in sensitive skin and rosacea. So if you have a client that has dealt with rosacea for a long time, say they're in their early to mid 60s, they've had a diagnosis of rosacea since their 20s, their skin, depending on the subtype, is going to be on the thicker texture side. And this is going to be because that Demodex mite has been actively working for a long time. Now, on the other hand, if the client is on the more oily side and they're a higher subtype rosacea with the um, papular and pustular type of acne, that skin's also going to be thicker because that overabundance of oil production has a thicker skin type texture to it. Now, if they're on the dry side and they've been trying to treat the acne for years, their skin's going to be on the thinner side. So you do have to make sure that you are taking into account what that texture is of their skin and treating accordingly. Now, we can't go right on in with even just like the lactic gel peel on people that have that thinner skin type. They're a little more sensitized as well as dealing with rosacea or sensitive skin. Again, that chronic inflammation. If somebody has that chronic inflammation of the blood vessel, they're going to have flushing in their cheeks, at least sometimes through that T zone area as well. It's not always just going to be the cheek. It can have that butterfly effect, which a lot of times, if the client comes in and they've written on their consultation form that they have lupus, you will see that butterfly rash as well if they're in a flare. A lot of times, rosacea and lupus do go hand in hand as well. You will see a lot of autoimmune diseases go hand in hand with rosacea because the way that the skin responds to internal imbalance and fluctuations does show in the skin. Now, sometimes it doesn't have to be as aggressive as giving a, official diagnosis of rosacea, but they might have some sensitivities if they're in a flare up. And a lot of times autoimmune diseases have some kind of inflammation imbalance. So that inflammation is also going to show in the skin. That's something that I deal with as well. All over my body, the inflammation can present due to my internal chronic autoimmune inflammation issues. So now we're going to hop into those subtypes. Like I was talking about, you're going to have that subtype 1 is going to be more just facial redness, erythema. Sometimes they're going to have what I like to call touch reactivity. So if you've done an oxygen treatment, if you're familiar with Circadia and you've done an oxygen treatment already on a client, specifically a rosacea client, and we all know that the oxygen treatment is fabulous for treating redness. However, the client might come off of your table a little bit more pink or showing a little bit more erythema in the skin than when they came in. That's going to be because of that touch reactivity. If you've done the treatment, you know it's very involved. We're manipulating the skin, we're massaging the skin the entirety of the treatment. And sometimes when that is happening and we have that touch reactivity, that redness is going to still be present. However, when they have about a couple of hours with no touch on the skin and you have finished your manipulation, that redness is going to go almost immediately away and they're going to look 10 times better than when they came in. Something that I like to talk about the oxygen treatment is that it's the gift that keeps on giving. It's the treatment that keeps on giving because days after that treatment is done, they're going to continue to see a change in their skin, a change in that redness. So I really see quite a difference with the oxygen treatment, specifically for your subtype 1. Like that's going to be an immediate yes, I need more, book 3, 4, 5 more treatments for me. And what home care do you want me to be on? Because this is amazing. Same with your subtype 2. That's where you're going to start to see those papular and pustular rosacea pimples as well. Now, this is where it gets a little bit of a gray area because it can come and go, right? They may come in and say, sometimes I have this flare up and sometimes it looks fine. And that's when I like to ask during my skin analysis, what is the level that we're at right now? If they're presenting with a little bit of pustular and papular, if it's at a 10 being this is the worst their skin ever looks, and a 1 being this is amazing, I have them give me a number. And that gives me an idea of, okay, if this is a flare up, they're at, say, they give me a 5. Okay, what have you done in the last week to 10 days? Have you been outside a lot? Have you spent some time in the sun? Have you done a Pilates class, hot yoga, all this stuff, saunas? What could be a trigger for creating this flare? When clients come in and they don't know what's going on, a lot of times, if they're not in tune with their body, they're not in tune with their patterns. So we have to help them get in tune with those patterns, right? And understand where their lifestyle might need to shift a little bit to get a full result that they're looking for. We all know that skincare is not just skin deep. We are working on a full body wellness level as well. And that really comes into play when we're dealing with rosacea. Now, when you get into subtype 3 and subtype 4, this is going to be a little bit more aggressive. And this is where things like calling in on the derm and going to the physician is going to be helpful, because that subtype 3, you're going to see a difference in the nose. Now, sometimes you will see this in smokers as well. However, that's going to be like 30, 40 years of heavy duty smoking. And then sometimes that can create what looks like rosacea in the skin. And then subtype 4 is going to be your ocular rosacea. So it's going to be something that presents all over as well as the eyes. Usually with rosacea, you're going to see just through that T zone, like I was saying, and throughout the cheek. Sometimes what I've noticed is if a client has a gluten sensitivity, you will see that redness through the lower half of the cheek as well as the rest of the cheek, and sometimes through the forehead and chin. It just depends. I do have a client that has dealt with rosacea for her whole life, and she also suffers from melasma. She's a sun lover. So when that client comes in and their concerns are both of those, what do we treat first? Both things are going to respond to anti-inflammatory treatments. So start there and then work your way into treating the rest of the rosacea, getting that taken care of and in a more controlled state. And then you can start moving into more aggressive treatments to treat the melasma. Because that's another thing. A lot of times your clients are going to come in and say, I've just always had red skin. I have these other concerns. I'm aging and I want to take care of that first. I need to take care of that now. I don't care about my red cheeks. Okay, well, we can really treat both at the same time. And we're making sure that that microbiome and your barrier is in a good place. And then we can also treat those fine lines and wrinkles. We can also treat that melasma. So that telangiectasia that I was talking about, also known as broken capillaries, if you hear that more often, they are the same thing. With rosacea, a lot of times you're going to see that telangiectasia, and you are going to see that they are much more prone to those broken capillaries becoming apparent. Now, in different lighting, it's going to look different. You can see in natural lighting, it's not as aggressive, and then you can see that they're almost actually a little bit more on the almost purple side at times. They're not always that deep and dark. Sometimes they are a little bit finer, thinner, more red lines. However, things like microdermabrasion, hydrodermabrasion, and even the firming peptide mask, these are going to elevate the appearance of the telangiectasia. So we want to make sure that we're keeping that in mind. Things that could be an alternative for microderm or things of that nature are going to be dermaplaning. The firming peptide can still be used if telangiectasia is present. However, you just want to avoid the area where that telangiectasia is. So what I've liked to do, what I used to do, is firming peptide everywhere but where they were present, and then marshmallow whip hydrating mask. However, now that the pre and postbiotic mask exists, I mix both of those together and put them on those areas. Usually it's through the nose and the cheek area, sometimes on the chin. A lot of times you'll see them on the chin if the client is more of a subtype 2 and they like to take an at-home extractor to their lesions and they try to extract on the chin and they haven't prepped the skin, the angles, all that kind of stuff that they are not aware of. And then they create a broken capillary or telangiectasia on the chin as well. So I actually really, really love this representation because you can see where the erythema is being presented, right? We can picture that. We can see that. That is what's going to get treated first. That's what's going to respond immediately. Then you're going to have some papules and pustules sometimes. And that's where, like, if a client comes in and says, I have acne, but this is what their skin looks like, they're likely dealing with sensitivity or rosacea. Again, we can't say, hey, you probably have rosacea. We're just going to treat it as such and take care of the inflammation first and treat it with things like mandelic acid or azelaic acid, which we also have in Serum 71, that combination along with the tranexamic. That is a perfect client for Serum 71, starting about 3 times a week at night. Will create results in like 2 to 3 weeks. They're going to see a difference, especially if you do an oxygen treatment in the treatment room and then send them home with Serum 71. Their skin's going to look totally different in 4 weeks when they come back to see you. Now you're getting more into that high subtype 2, sub 3, where that's severe erythema. It's a mask over their skin. They're like this all the time, and then it gets worse if they have a trigger. This is where their just normal state is. This is something that's going to take a little bit of time to treat, right? This is going to have to take a very gentle hand. I would just go in with something like this. I would start with no exfoliation, one oxygen treatment, a very gentle mask, marshmallow whip, and pre and postbiotic would be a great mixology option for you. And LED light therapy is going to be very helpful for these types of clients as well. We also want to be using cool towels. We don't want to bring heat to the skin where we're already trying to decrease and bring that temperature down, right? And here you're going to see that subtype 3 more so where you're seeing that inflammation and in the nose, and then that can create scarring as well. If especially if you have a client who is more prone to picking at anything on their skin, they're going to scar easier. And this is going to be a more elevated needs surgery. They have to be referred out. This is not something that we can help them with, unfortunately. Okay, now we're going to get into the Demodex. So, what is this thing? Why do we have it? What is it doing? Like I said, it is a important part of your microbiome. It's much like our gut, right? We have good and bad bacteria. However, it is all still necessary to be prevalent and keep a balanced lifestyle and healthy body. Same thing with our skin. Your Demodex is important. We have to have it. However, like I said earlier, with your clients who are diagnosed with rosacea, even just subtype 1, they have an elevated amount in the accumulation of those Demodex. So they're very small mite, they're teeny, teeny, teeny in the hair follicle. They're mostly going to be in your lashes and your brows, and then also in the skin as well. And because we do have those hair follicles in our face as well, right? So it is your technical term is Demodex folliculitis, and that overabundance can create imbalances, whether it's going to be chronic inflammation, that it can be at a point of contact dermatitis. It's going to create reactions to your external factors. So, like when you're outside a lot, if you have rosacea and it's hot, those Demodex get really excited because your oil production is going to be higher as well as your sweat production, and they do feed off of that. So, as they start to become more prevalent, then those side effects of the Demodex mite is going to be present in the skin with that redness, with the dryness. Sometimes itching can occur too. If you have an overproduction of oil levels and those Demodex mites are feeding off of that, that's when that pustular and papular inflammation and lesions are going to occur as well. Now, causes for your sensitivity and irritation, like I said, it's very much related to the gut in its own way, but it's very much so like the gut as well. If someone goes to the doctor for a gut issue, there are a million different reasons as to why it could be occurring. Same thing goes for sensitivity and rosacea in the skin. It could be so many different patterns or reasons or external factors or even internal. So that's why we have to make sure we're asking those questions, right? That chronic inflammation, the contact dermatitis, even immune system dysfunction, like I was saying, those autoimmune diseases that are completely internal do present in the skin, and it can be something that we want to make sure we're asking about. That's why it's so important to have a more in-depth consultation form than just what are your allergies and do you spend a lot of time outside and what's your lifestyle like. We have to know some medical history as well. So, knowing those internal things and things that we have to ask for our consultation form and what might be something that's a trigger, we also want to know we're able to detect what those visible indications are, right? So, diffused redness, that warmth and discomfort. A lot of times you'll have a client that comes in and says, my face just hurts sometimes. It's so tight, it's so dry. And because of that, they're going to be reactive because that microbiome has nowhere to go. It has no leg to stand on. Everything is going to make it hurt. So we have to come back in with more comforting and nourishing and balancing ingredients and things like that. We're going to talk about some hero ingredients here in a moment as well. Now, like I said earlier, that telangiectasia is going to be a very hard visual telltale of if someone may be just beyond sensitive skin. They may actually need a rosacea diagnosis. And also that keratinization, like I was saying earlier, sometimes when you do that skin analysis and you're touching and you're feeling, especially when you first go in with vitamin veil, that's why I use vitamin veil as my pre-cleanse, one of the reasons for everybody, no matter what, because I can really see how the skin responds to extremely nourishing and hydrating as opposed to just a foaming cleanser going right on in. Even though the lipid replacing cleansing gel is gentle and it can remove makeup, I do start with the vitamin veil so I can see what that texture change is and even the life, quote unquote, of the skin changes too. Because a lot of times when you're doing a skin analysis before you do your first cleanse, skin is going with rosacea and sensitive skin, that skin's going to be very hard to respond. It's going to bounce back very slowly. You're likely going to see that dryness and flakiness happening. And then when you go in with vitamin veil, it usually changes the entire conversation. So you want to make sure that you're taking a look at how much dryness and flakiness is happening and then think about what their home care is. Is it happening because of their home care or is this something that happens all the time for them? And then acne, of course, it is so sneaky. I think that people really started to understand more so about how sensitivity and acne go hand in hand after COVID, with masks being worn very frequently and creating friction, creating irritation, things of that nature. And then acne was a response to that. We started pivoting and treating it more like a sensitivity and inflammatory response as opposed to just trying to kill the bacteria. Now, contact dermatitis. This is something that will present at its worst with those watery blisters. That's one of the reasons why you want to make sure that if you're seeing that present in the client's skin, that you're referring them out to get a physician's care. Because sometimes contact dermatitis does need something of a prescription. It doesn't always just respond to things that are nourishing, calming, and hydrating. We want to make sure that the client is being treated fully to the care that they need, right? So you're going to have these things where contact dermatitis can have inflammatory flare-ups. It's not something that just comes in then goes away one time. It can be something that is more aggressive in the way of that it's something that has to be maintained and keeping that in mind as well when they're coming in for treatments. If they already know that they have contact dermatitis or atopic dermatitis, which we'll talk about next, we want to keep that in mind for if we're utilizing more mechanical exfoliation, if we're utilizing things of, a little bit higher and aggressive when it comes to what other concerns they're trying to treat. A lot of times they're not just going to come in for sensitivity or a form of dermatitis that they're trying to get taken care of. A lot of times it's going to be other regular quote unquote concerns, right? Things like melasma or pigmentation or fine lines and wrinkles, or they're looking to just have come in and, take a nap. Sometimes you have clients that come in and they have things like this and they have no idea. They just are coming in to relax. So if you can actually give them both, that's a win-win, right? That's going to get you 7 more referrals from just that one client because you took care of something that they didn't even know they had. So your atopic dermatitis is going to be more of that dry itchiness and inflamed patches. Sometimes it will look like eczema and it's not. That's again another reason why if that's happening, and it can happen all over the body, not just on the face, but if it is, we want to make sure that we're referring out to make sure or ask them, do you have a diagnosis of eczema or psoriasis? So we can then differentiate, okay, is this a flare up for them or is this something else? Things that can do this are going to be like you'll see it around the mouth a lot. Sometimes that can be from a toothpaste, something that's touching the skin that isn't necessarily a bad thing, but it's not good for their skin. So something that I always tell everybody, regardless of sensitive skin or not, brush your teeth and then wash your face. It's just like wash your hair and then wash your face. Get all of the things off of your face that may not need to live there after it's already been done and taken care of and balanced. So we want to make sure that we're doing our steps in a little bit of a different form. It can be something as simple as that changes a whole entire client's face and their life. And they're like, I didn't even think to do that. And that is just one of the many reasons why being an esthetician is so fun because it can be just as simple as that. Or we have to put that detective hat on and really take a peek and see what's going on. Ask those questions. It keeps that critical thinking right on top of us, right? It keeps that brain food happening, which is what I like to call it for our not actual food, but brain food as far as keeping us on our toes. Now, you will see in both forms of dermatitis here that the immune system of the skin is imbalanced. So if we can work on that and get that a little bit more balanced, we're going to have a happier response in the skin. And a lot of times dermatitis is going to have hypersensitivity. So we're not going to want to do things like the oxygen treatment that have a difference in pH level changes right off the bat. We want to do things that are more soothing with red light therapy and things like that. And then once that kind of gets more taken care of, we can go in with the oxygen and help balance out the barrier afterwards. Keeping things separate as far as your external factors, we've touched on that a lot, and our internal factors. We want to make sure that we have both of those going together, but keeping them separate, right? We want to make sure that if your lifestyle here is different from the internal factors from this client, it's not going to be the same for everybody. So this is what's happening with the immune system, that dysfunction that's happening. Basically, your T cell activity is going to be overactive. Your T helpers are going to be overactive. So that's why I actually really like the hydrolox oil for clients who are experiencing things of this nature and even eczema and psoriasis. With both of those, your T cells and your T helpers are going to be overactive as well. And the CoQ10 in the hydrolox helps balance those out. Hormonal fluctuations. So that client that I was talking about earlier really suffers from rosacea, but as well as from melasma, and she's going through hormone replacement therapy. So a lot of times when this is all connected and going together, you're going to have an increase of sebum. And if they suffer from rosacea, even if it's just a subtype 1, they might bump up to a subtype 2 because they're going to start experiencing those papular and pustular lesions because of the hormone replacement therapy. But then the sensitivity from the rosacea is making the Demodex mites even more overactive. So they're having more sensitivity and more inflamed skin, whether it's just the redness or your papular and pustular lesions as well. Okay, so here are some of those commonly prescribed medications, and a lot of times the side effects from the treatments can be worse than the actual treatment itself, right? So we want to make sure that we know, again, what are those medications that our clients are on, oral and topical, super important, because sometimes they might be on a very high level of azelaic acid and their skin is responding to it, but it's also making them really dry. So they might need something like post-peel balm at home to counteract that super dryness, and even the hydrolox oil as well would be a great option. Burning, photosensitivity, just increased redness and sensitivity, especially with more of those topicals like the ivermectin. Sometimes you will have a very high level of sensitivity, but man, those papular and pustular lesions, they're going away, but I'm really sensitive. You can't look at me with the 10-foot pole and I'm going to turn red and it's going to feel itchy. So if that's happening, what I like to do is tell them, hey, go back to your physician and say, this is what's going on. These are my side effects. Can I back off? Can we lower the dosage? What's my option here? As well as sending them home with things like vitamin Veil and post peel balm and things like that. Very nourishing and hydrating is what we're going for. And here are some of our hero ingredients. Some of my favorites. I mean, it's very hard to choose a favorite out of these guys, I must say. But the cocoa enzyme is a tried and true for me. It is something that really helped my redness when I first got started. It's a huge hit for my rosacea clients. But I also really like the aloe and calendula calming mist. Those guys are two hero ingredients that I'm always reaching for. There's aloe in a lot of Circadia's products that I really enjoy. Even your more treatment products, you are always going to see a balancing ingredient coming behind it, like aloe or a niacinamide or an antioxidant, to help balance out any sensitivity issues that may occur, specifically in the nighttime repair. Absolutely love that niacinamide got added to that because it really does help with the sensitivity. And I think that it really gave it a super luxe texture and just really silky. It's so nice. Absolutely love it. If I could bathe in it, I would. So nice. But you're also going to see the CM Glucan Forte. That is going to be in Serum 71. And it is also going to be a hero ingredient with the tranexamic, azelaic, and mandelic acid in there. This is why this is just such a great serum for everybody because it touches on so many different concerns, but specifically rosacea clients can use this. Okay, Candace, is it all you now?
Okay. I'm just looking at the time. I think if you want to just kind of quickly go through some of these product knowledge slides, and then we'll slip over to the new calming facial protocol that's coming up. So we may not talk about all of these in depth here, but just a quick touch on these, and then I'll take it over on the concept.
Perfect. Okay, so like I said, the aloe and calendula calming mist, it is so good. I use this in the treatment room for mixology. I send clients home with this all the time. This is like a medicine cabinet thing for me. I have it in the medicine cabinet for more of like my itchy, mosquito bites, things like that. Any kind of stress hive, it's really good for, and it feels really good on a sunburn too. I know we're talking more sensitivity and rosacea, but great for sunburns. The sea whip extract in here, I feel like gives almost the immediate result as far as taking the diffused redness down. Tranquility Cream. If you guys see me in the educational forum, you see me recommending Tranquility Cream for like everything. It pairs so well with other things, specifically the new Aquabiotic moisturizer that just came out. Great for clients who need that microbiome repair, but also need a little bit more hydration because the Aquabiotic is that water base. So you'll do the Aquabiotic and then layer the Tranquility Cream on top. The Sepicom, that was one of the hero ingredients that you'll see on that slide a couple slides ago, as well as in the aloe and calendula calming mist and here in the Tranquility Cream. I really like it because it is part of that immediate response of ooh, the skin gets to calm down. The Sepicom really helps with that, as well as the transepidermal water loss with this product is so nice. I like mixing it with the pre and postbiotic. If you guys use it in the treatment room, try it with that, see how you like it. Now, the Rosie's Relief Cream. This is going to be something that you want your clients who have diagnosed rosacea to use and spot treating. So we're using on those areas that I was talking about of how you're really going to see it, the chin, the cheeks, more in that T-zone area, 2 to 3 times a week. during a flare up. Now, the ingredient base in here is very particular and intentional for treating that mite and making sure that that is on a more balanced level, but not overdoing it because, like I said, those mites are important for our overall microbiome. So we don't want to use it every day to then decrease to a point of where we don't have enough. Think of your rosacea serum as your pro treatment of Rosie's relief cream. You're going to use this in your treatment room only. It's pro only because it is quite spicy. Do tell your clients this is going to have an immediate flush, but then it's going to calm down. So using this before your finishing products, after your pro treatment of your exfoliation or your oxygen treatment or whatever your finishing mask is, you're going to use this again in those areas of concern only, not full face. Post peel balm, this product, you guys, it goes for anything, anytime, anywhere on the body. I absolutely love this. I now have a back bar size in the bathroom because my boyfriend just cannot keep his hands off of it because he has psoriasis and it works so well for him. The royal jelly in here sometimes will create a little bit of a tingle if the barrier is impaired a little bit. This will dissipate in about 30 seconds. So if a client is experiencing this, it's okay. Have them on it again for another week or so, and that will start to subside. Cocoa enzyme, like I said, she's one of my favorites. One of the most popular enzymes we have for sure. Great for vasoconstriction, great for pairing with the oxygen treatment. But again, you are going to have three forms of an enzymatic protein in here. So if they are very impaired, you probably will want to only do this for about 3 minutes with no heat, just keeping it damp, just to keep it active and not accelerated with heat. However, if they are super, super impaired, you could do the caviar, lime, and passion fruit enzyme mask with the marshmallow whip instead. And then the next time you see them, do the cocoa. Start building up. Snow algae and spirulina, absolutely so good for mixology in the treatment room, but it's good for especially that diffused redness. Really get that calming aspect from the algae that's in there and the aloe. High levels of aloe in here, which is great, of course, for your sunburns, but for your diffused redness and your, especially your telangiectasia, I feel like the vitamins in here really help to decrease the appearance of the telangiectasia. I've been preaching the pre and post all day. We all know how great this is. Again, you're going to see that glucan forte in here as well. But even for your clients who come in with multiple concerns, the rosacea is up there, but they are in front of a computer all day long, the Circin Blue, awesome ingredient. You're also going to see that in the circadian time balancing mask as well. So you can mix those two together if you need to for a client who has a lot of digital pollution and blue light exposure. Oxygen treatment, like I said earlier, it's a tried and true. It was created for acne and rosacea as well. So that's something, of course, it's great for everybody, but that's something that I do tell clients when they come in and they're a little skeptical about getting another rosacea treatment. This was created specifically for you. And then I tell them my story of how this was my gateway treatment into Circadia because it was the only thing that I'd ever tried that actually did something for my skin. So I was sold immediately after that. But it is great for everybody. So don't think that if you just treat anti-aging and rosacea and sensitivities are not a high level client for you, you can still benefit from having this in your treatment room. We're going to hop into some of our amazing before and afters from our skin transformation challenge that we just did. This is running again this year. If you guys are interested in doing that, highly recommend. You can see these in our lookbooks as well. That is available on Image Relay in our resource center, and there are hard copies of them as well for you to be able to have in your treatment room to show clients. Okay, this one blows me away every single time I see it. Like, are you kidding? This is 100% subtype 2. She's dealing with diffuse redness, mild papulars, and pustular lesions as well. She was treated mainly for sensitivity, but you will see that white willow and juniper clearing mist in there for home care and, AM and PM. We do have to treat that oil production as well. This one also gets me. Like, night and day difference. If that was me, I probably would be crying. Like, are you kidding? I guarantee she feels like she can go out in the world with no makeup on. And that's what we're going for in the treatment room, right? That's what we're trying to do. Another one, absolutely amazing results. Look at that skin texture and just overall appearance of the skin looks completely different. Absolutely amazing.
So calm. She's so calm.
Just like, I'm here.
Yeah.
I have tinted SPF on. Just kidding. No, this is my skin. And the texture here too, like, oh my gosh, look at just the dry flakiness, and you know that has to be uncomfortable, and it's gone, gone. And you can see that she's using the Rosie's Relief Cream as well as Hydrolox. So that Hydrolox, I feel like Hydrolox is a little bit slept on for rosacea and sensitivity clients. Just gonna put it out there. You guys try it.
I agree with you. I agree. Wonderful. Savannah, that was fantastic. Thank you so much. I
Of
know
course.
that, we are people who are very passionate about these products and we could talk about them all day long. So, if you have further questions about the products or anything in this presentation, please do feel free to reach out to me or Savannah, and we will answer your questions. I do want to spend just a few moments here talking about our upcoming calming facial protocol. This is our newest in our series of Circadia signature facial concepts. Savannah, if you can advance for me. Fantastic. So calming facial, that's been really the theme of our education today is calming the skin, whether the cause is rosacea or some other internal or external factor that's creating sensitivity in the skin. Calming is the message of today. And this new facial concept will be launching next Monday, March 17th, here in the United States. We are very excited about this one. I think, if you were to pick what is the thing that I will definitely be treating in my treatment room, hands down, everyone will be treating sensitive and irritated skin. Maybe it's because your client has rosacea. Maybe they have, some other skin condition, or maybe they're just receiving really aggressive treatments. Maybe you are treating them or they're being treated somewhere else with more highly aggressive treatments and they need that calming. Maybe they're treating themselves inappropriately at home and they need you to come and fix what they're doing, creating that fire in the skin. So the calming facial concept will be probably one of your most absolutely versatile treatments that you'll be able to offer. I would say anyone can benefit from it, anyone. And because inflammation is prevalent with so many other indicators in the skin, inflammation is 100% relevant to aging. It is absolutely 100% relevant to acne, inflammation that causes pigmentation issues like melasma, inflammatory hyperpigmentation, post-inflammatory pigmentation. So sometimes it's about finding the root. What is the actual cause of what the person is experiencing? So maybe they're seeing the acne or they're seeing the pigmentation or they're seeing the glycation or whatever happening in their skin. But what's really at the root is at least in part due to an inflammatory response in the skin. So you can tell I'm very excited about this facial concept. And I think people don't get excited enough about calming the skin. I think estheticians get very excited about peels and needles and all of these things that seem very exciting. But at the end of the day, calming the skin, nourishing the skin, you know, um, protecting our barrier because none of these other exciting treatments that we do will be effective or safe if we aren't taking the calming and nourishing aspect of the skin very seriously. So, that being said, sometimes your skin can get stuck in this kind of endless cycle of inflammation and discomfort. And it becomes a vicious cycle where my skin is inflamed. So this thing happened. So it made my skin inflamed. So you get caught in a cycle of inflammation. So the goal here is to target the causes and effects of inflammation in the skin, soothing the skin, promoting an even tone and texture, and reclaiming the proper healthy balance within the skin. So, um, this calming facial concept, the education will include a lot of those causes, just as we just talked about. So getting to know the calming facial, what's the science behind the calming facial, the hero ingredients and products that are within this protocol complex. You will learn about your guest demographics. Who is this treatment good for? Which really. It's good for everybody. Everyone can benefit, but you'll learn about that ideal, the client. You will gain information about how to provide a quality consultation that will guide you to giving, is this facial for this client? Are there ways I can take this facial to another level? What home care products would I want to recommend for my client here? So, getting those consultation questions, those keys to really aiding in that discovery process with the client, you'll learn all about that here. And then, of course, our step-by-step protocol. Next. Okay, again, talking a little bit about the root causes. This is what's great about these facial concepts too, is we really dig into any question that you could have. And we break it down on both the professional esthetician level, but also the consumer level, so that you can help to understand and explain to your client what is going on with them. So as you'll start to see, a lot of the resources that we're creating in the education program here right now are geared toward also being able to give you the tools to educate your client in a way that they can comprehend. Most of us, if we go see a physician for a health condition, sometimes they'll give us an information brochure on, hey, this is what's happening within your body. This is your condition. This is why it's happening. And it helps you as a patient to understand what is happening to your body and how to treat it. So we want to be able to deliver that same type of education for your customer on the skincare side of things. So we will talk about the root causes of these conditions, the visible symptoms that you may be able to see or they may see, or that you can experience and discover when you're performing a skin analysis. We dig into ingredients in each product as to what ingredients help to alleviate that target cause, and the products, of course, themselves. Okay, so talking a little bit about the calming products and ingredients. Oh my gosh, this toolkit has the best of the best in it. It's very exciting. Obviously, our cocoa oxygen and our very beloved post peel balm. As Savannah said, I almost hate that the name says post peel because it's so beyond just post peel. This is a product for everybody and for so many different skin conditions. Okay, what are the three heroes in this facial protocol? Our Oxygen RX treatment, which we just touched on, our cocoa enzyme, and then we haven't given enough love, in my opinion, yet today to the alpha gel mask with the calming powder blend. I know for a fact that this is one of Savannah's favorite things we've ever brought to her treatment room. She's loving this product in her treatment room. I am loving this. At home, I have my own little laboratory where I experiment on friends and family whenever they're willing and able. And I am absolutely madly in love with the Alpha Gel mask with the calming blend. So it's so hydrating too. The Alpha Gel mask, you can just feel the soothe the minute it touches your skin. And then as the ingredients in that calming blend start to work too, it just takes all that fire down. It takes all the heat and inflammation and irritation down, and it feels phenomenal. It leaves the skin glowing in a good way rather than glowing in a red way. It's glowing in a healthy, vibrant, calm way when you're done. So these are the top three treatment products that are within the facial protocol. We already talked about these. We'll go ahead and skip over. I know I'm almost out of time here. But this toolkit will also talk to you again about how to present the calming facial to your customers, which I think is a really incredible benefit of these toolkits, because being able to explain to the customer why this facial is going to benefit them is a wonderful asset to your and your clients' businesses. Okay, digital success toolkit. All of our facial concepts include these things: education for professionals and consumers, frequently asked questions, product and ingredient technology, the protocol in both a written and a video format. And the videos are all found on Circadia University in the protocol curriculum. So you will go to Circadia University, you'll click protocols, and then you'll find it there. But also the consultation guide, the business implementation tools, and of course, all of the absolutely beautiful pre-designed social media posts for you. It takes the work out of it. You go in there, you grab your beautiful images and you post them up, and it's just a absolutely phenomenal turnkey way for you to promote this facial protocol in your business. And then lastly, what does it include? It includes all of these products listed above, including two Oxygen RX kits. So you are able to, oh, this slide wasn't updated, but this will basically cover 24 treatments. And the suggested price will vary depending on where you are in the world, but your estimated revenue, your estimated return on investment is 600%. So a very healthy business reward for you there. So that is the important pieces of information. Do contact me if you have any further questions about the calming facial protocol itself or about any of the material that we covered today. We're also going to send you the recording. We will send you the presentation that we used so that you have it, including some speaker's notes. So if you ever are looking for the right words to talk about these concepts, we've got you covered there too. I don't know if anybody has any questions. I know we just hit our end time, but please feel free to email me at Candice@circadia.com. That's CANDICE at circadia.com. And if you have a question for Savannah, I can also forward to her as well. So thank you so much for being here with us today. We appreciate you and we look forward to seeing you in a couple of months in Dubai, hopefully. Thank you, Savannah.
Thank you. I hope you guys have a great day.
Wonderful. Thank you. Talk to you later.